So sexually transmitted infections, also known as sexually transmitted syndromes, that can be acquired and transmitted through via sexual activity. There are various infections that are caused by different pathogens from bacteria, fungi, virus, and parasites. Early detection and treatment of sexually transmitted infections reduce the spread of the infection and may avoid or delay serious complications and consequences. STI infections spread primarily through sexual contacts. They can be bacterial, viral, or parasitic in nature, as we have already stated earlier. So the commonly sexually transmitted infections are, for the bacterial infections, are chlamydia, gonorrhea, syphilis, and bacterial vaginosis. Bacterial vaginosis was added here basically because we're trying to dispel the fact that most people or most women, just like the name implies, bacterial vaginosis, it affects the vagina or the female person itself. So, but most women will feel, oh, it is as a result of men. It doesn't actually, it's not a sexually transmitted disease in the sense that it cannot be transmitted from a female to a male, but the male can be a carrier, especially if he practices um, on safe sex, and it can affect the female, and then he sleeps with another female, he could transmit it to her. Viral infections include hepatitis B, herpes simplex virus, human papilloma virus, and HIV virus. Now, for the bacterial infections, they are all curable, but for viral infections, they are not curable, but they are treatable in the sense that we have reliable vaccines for hepatitis B and human papilloma virus, which help to prevent us getting infected by the virus, one, and also help to prevent certain cancers that are connected to the human papilloma virus. Parasitic infections include scabies, trichomoniasis, pediculosis pubis, and then the fungal infection, balanitis. Balanitis is inflammation of the penis, and then vaginal thrush. A brief epidemiology. So in 2020, there were an estimated 374 million new infections in people aged between 15 to 49 years, with one of four curable STIs, either chlamydia, gonorrhea, syphilis, and trichomoniasis. So what this makes us understand is that the bacterial form of the sexually transmitted infections are most likely what are being acquired most easily. They are easily more spread than any of the other infections. STIs have a direct impact on sexual and reproductive health through stigmatization, infertility, cancers, and pregnancy complications. Over 1 million curable sexually transmitted infections are acquired every day worldwide in people aged 15 to 49 years, with the majority being asymptomatic. Hence the reason for this webinar today, to let us know how how rampant it is for sexually transmitted infections to be gotten, and to make us more aware and to be more conscious and be more careful as to not get infected by these bacteria or viruses or fungi, as the case might be. More than 500 million people aged 15 to 49 years are estimated have a genital infection with herpes simplex virus. Human papilloma virus infection is associated with over 311,000 cervical cancer deaths each year. Not too long ago, we actually at the facility we actually tried creating an awareness for cervical cancer, and even offered cervical cancer tests and also vaccines. So if for any reasons, please, we encourage people to try to come in for the human papilloma virus testing, and also to try as much as possible to get the vaccination, so as to reduce this number of cervical cancer deaths, especially in women. 1.1 million pregnant women were estimated to be infected with syphilis in 2022, resulting in over 390,000 adverse birth outcomes. Drug resistance is a major threat to reducing the burden worldwide. How are sexual transmitted diseases spread? Just like the name implies, number one, we already know, is via sexual contact. Now, sex could be in different forms. It could be either vaginal, anal, or oral. mother to child, especially via syphilis. This is what we call vertical infection. During child delivery, the mom could transmit the disease to the child, or during breastfeeding, which is very rare, and it has a very low case of transmission. And other non-sexual transmission could be through sharing of needles. So for those who actually do intravenous drug use, they are at risk of getting sexually transmitted infection. So signs and symptoms of sexually transmitted infections. As we already stated initially, most times they are asymptomatic until there is some form of maybe organ infectation, or maybe some form of immunocompromisation. That is, our immune system is a bit dropped, is not performing optimally. So for the bacterial infections, chlamydia most times asymptomatic, hence the reason why it is one of the readily and easily transmittable disease from during sex. It is the causative agent is known as Chlamydia trachomatis. The possible symptoms include genital discharge and burning sensation during urination. These are the common symptoms. So you might actually experience these symptoms, and it might not necessarily be chlamydia, but this is what you're most likely going to experience. So if you experience this, please visit your healthcare professional very quickly. Gonorrhea, causative agent is known as Neisseria gonorrhea. For men, commonly it is a urethral discharge and painful urination. Now, gonorrhea has a peculiarity because for men, it is symptomatic in the sense that men normally would come in with the urethral discharge and painful urination. But in women, it's oftentimes asymptomatic. Maybe occasional pelvic pain or lower abdominal pain and vaginal discharge, but that's not enough. So for women, it leaves a long-time complication with issues with getting pregnant. So over time, when it stays in the system for so long, especially for women, it could cause some issues with infertility. So that is, I think, the symptom in women is infertility most times. And so most times when we have women who come in with infertility, it is one of the things that we suspect they might necessarily may have had over the time. Syphilis, causative agent is known as Treponema pallidum. It's divided into three stages, and for all these different stages, there are different symptoms. So the primary stage is the painless sore known as chancre on the genital. So you have these very tiny injuries on the penis or on the vaginal around the vulva area, and the rectum or the mouth, depending on what side the sexual intercourse was, where the bacteria entered into the system. And it's normally transmitted, especially if one has like sexual intercourse with a break in the skin. So maybe injuries around your genital area or around your mouth. The secondary stage is characterized by skin rash, mucous membranes, lesions. So you have like lesions that look like as if they are vesicular injuries around the area. And then tertiary stage, which is the most dangerous stage, is where it affects internal organs and it causes neurosyphilis. So it crosses the blood-brain barrier and then begins to affect the brain. Other infections include chancroid. Chancroid is caused by Haemophilus ducrei. It's a painful genital ulcer with swollen lymph nodes and it's highly contagious, but it is curable. Lymphogranuloma venereum, primary infection. It has two stages, so the primary and the secondary stage, which is the difference between this and syphilis is in the syphilis point, the sores are painful, but in this one it's painless. And then we have a secondary stage where you now have painful genital swelling with possible abscesses or possible what we call boil. Abscesses are boil. One of the complications of STIs, especially in women, is what we call pelvic inflammatory disease, and it is normally caused by chlamydia and gonorrhea. It is characterized by lower abdominal pain, abnormal vaginal discharge, painful intercourse, and in most dangerous cases, infertility. Importance of testing for early detection of STIs, regular testing, especially for sexually active individuals. So as long as you're sexually active, it's very important that you have regular testing, and especially if you practice unsafe sex or have multiple partners, it is always good to, as much as possible, do regular testing. So now when we say regular testing, it doesn't mean that every day you have sex with some partner you have to come in for a testing every time. It means that you should, from time to time, um from time to time, go in for testing, maybe 3 months, 2 months, as the case might be, just to make sure that you are not infected by any of these bacteria. And then early treatment. So the point of early testing or regular testing is for us to detect these bacteria, viruses, or fungal or parasitic infections on time, so that we could treat appropriately and in due time. And this to prevent further complications and transmission. What are the prevention strategies? Globally, the prevention strategy for sexually transmitted disease, just like it has been said, is what? Abstinence. So as long as you're not having sex, you are not going to have any sexually transmitted disease. Practicing safe sex is the use of condoms, making sure you go for regular checks for yourself and your partner. Um, Also making sure that you practice good or proper oral hygiene if you practice oral sex to prevent the spread of the infection. Also limiting our partners, this is what we call monogamy, as much as possible, trying to have one partner and maintaining the same partner. And lastly, vaccination. So as much as possible, get vaccinated for all the necessary infections that we know have vaccines or have or have or appear to not be that do not have any form of cure, just like hepatitis B and human papilloma virus. So once you're able to get the vaccines, they help to prevent you from having the infection. So they help to prevent. It is not that it is 100%. There are cases where you might have the virus even after the vaccination, but it is very important that as much as possible we get to do the vaccination. It is encouraged. Now for treatment. Early detection and treatment of STIs is the key to preventing infertility caused by STI. Infertility is one of the complications of STIs and is a um, very dire complication because it affects both the males and the females. So it's not affecting only one population, and it is a very major problem, especially for partners who have long-term goals of procreating. The following is necessary for effective management. One, we need medical treatment. So once we've done the testing, we place you on the appropriate treatment. It could either be antibiotics, antivirals, or antiparasitics. Then treatment of your partner. So for prevention of it to be reinfected, or for prevention for you to reduce the spread both in the community and in the world at large, is also to treat your partner. So it is selfish to come in for treatment and not treating your partner or your other partners. It is very important that while you get treated, your partners and every other one also gets treated. And then follow-up testing. So it ensures effectiveness of treatment. So it's not enough to come in for us to treat you, give you medications. It's also very important that you come in for a follow-up to make sure that we have achieved a form of disease control or a form of disease eradication in your system. Now, we have to create awareness and stop the resistance. Now, STIs are very preventable. Early detection and treatments are very, very crucial for everyone. You have to protect yourself and your future fertility by adhering to sexual practices and visiting facilities for regular checkups. Just like the little flyer that is attached to this picture, it says drug resistance is making sexually transmitted infections challenging to treat. So practice safe sex. So yes, because of the fact that most times people have sex and then they do over the counter treatment. So I've had sex with someone and then the next thing they want to do is go and take antibiotics or take any medication because they feel they've done something wrong. So as a result of this, these bacteria every day they are building resistance to these medications and hence makes treatment very difficult. So something that would have been treated with probably one antibacterial may need a lot of combination medications for us to be able to eradicate it from your system. So as much as possible, we are advocating for reduction in self-medication. If you know you have practiced unsafe sex in a certain period of time, please visit the clinic. Let us run a test on you. If there is a need for medications, definitely you'll be placed on the appropriate medications. But if not, please desist from taking medications off the counter because you feel, especially antibiotics, emphasis on antibiotics, especially because we feel we have practiced unsafe sex or because we want to take other things. So with this, we have come to the conclusion of this slight webinar, and we'll be taking in questions now. So we'll be taking in questions so we are able to know what you want to know more, what should we clarify more on sexually transmitted diseases, if there are any myths or anything you've heard about before concerning sexually transmitted diseases that you want us to clarify for you, then please go ahead by all means. We are available. Thank you. Dr. Obinna,
Thank you.
you can go ahead.
Thank you, Dr. Pere, for that very brilliant presentation and straight to the point. I see you've judiciously used your time so we can have more time for question and answers. So over to us, participants. Do we have any questions? I'm looking at the Q&A section now. There's been no question dropped. Even in the chat section, there's still no question there. So I don't know, do we have any questions you could signify by raising up your hand, and I'll unmute you and give you the opportunity to speak. Yes, anyone. So Dr. Pere, you mentioned you mentioned that some people have the habit or practice sometimes of taking over-the-counter prescriptions. That is, they may have just been exposed sexually and they decide to take maybe some antibiotics. So what would you recommend? Where can we get tested? So can STIs be tested in any place? What do I look out for? How am I sure of a place that I can do STI testing? Thank you.
Well, in our facility, we do this test. We have a lab that is well accredited for running this STI test. It's not every lab that has the possibility of running sexually transmitted diseases. Hence the reason why it is very important to first of all consult with a doctor, because sometimes some people just come in and say, oh, I want to run tests for STI, just like that. And it's not every facility that has this opportunity or have the kind of labs that can be able to run this kind of testing. So it is very important that you consult with your doctors. Most times, if it's not people coming to our facility, like our facility has that opportunity, we are able to run this test in a good record time that gives us the opportunity to be able to make the appropriate diagnosis just in time and to reduce any waste of time for treatment of the patient. So it is very important that, yes, you visit well accredited facilities, not just any facility. So there are a lot of facilities, a lot of hospitals or clinics in the country currently, and most of them, some won't even send you for testing. So the question mark is when you see a doctor or you see a medical practitioner and you complain about these symptoms we have explained earlier, and they just tell you, oh, start taking this medication, there should be a question mark. You should be expected to be tested first of all before we could start placing you on any medications.
Okay.
Does that answer your question?
Yes, please. Then somebody's asking, so if I've just had sexual intercourse as a woman, can I use soap to thoroughly wash? And if yes, what kind of soap? And if no, what would be your advice?
Okay. After having sex, for both male and female, it is always advised that you go into the bathroom to wash off, take your bath, and have a good wash. Now, most women have this thing of trying to use soaps to wash the vaginal area, which is really not good, especially using of antibacterial soaps or some specially scented soaps that they want to use to wash the vaginal. It is not good. So you just need to use either normal running water, or if you must use soaps, it must be alkaline soaps or non-scented soaps. Non-scented soaps are better, and there shouldn't be douching. So there's this thing where people want to wash into the vaginal cavity itself, trying to wash off whatever it is they think they are trying to prevent, which actually helps to spread or create more bacterial infections for the woman. So there is really no need for all of that. Just a simple wash is enough with normal clean running water, and you're good enough. So it helps prevent any form of sexually transmitted disease. So it is advised after sex to always go and clean up yourself by washing yourself off.
Okay,
So I don't know if this answers the question for the person.
Okay, I guess.
I'm listening.
So we have this other questions. I guess you can handle the two together. So it says, is hepatitis C also sexually transmitted? Is it also a sexually transmitted disease? And the other person is asking, does vaccination cure hepatitis B, or does it only prevent the carrier from infecting another? Did you get that?
First of all, hepatitis. Yes, I heard you.
Yeah.
Okay, so hepatitis B is the first question was hepatitis C. If it is transmitted sexually, yes, it can be transmitted sexually, but commonly it's via blood or sharing of needles. But yes, it can be transmitted sexually. And also, apart from the fact that it can be transmitted sexually, it is treatable. So of the hepatitis spread, hepatitis A, B, C, D, the common or the most dangerous of it is hepatitis C and B and D in some cases, but D doesn't occur on its own. It occurs as a co-infection with either B or C. So for hepatitis C, it is treatable. So if you get the infection, it is most likely going to be treated. But for hepatitis B, just like the other person who asked if it's possible to be vaccinated, yes, there's vaccination for hepatitis B, but no vaccination for hepatitis C. Then for hepatitis B, once you have gotten the disease, there is no vaccination for it. Because why? The vaccine given for hepatitis B is a live vaccine. So imagine you already have the virus and I'm introducing the virus again into your system. It would only cause more illness for you. So yes, we do not give hepatitis B vaccine to people who already have hepatitis B, but we could give it to their partners who do not have hepatitis B, the vaccine, so that it will help them to help prevent you from having hepatitis B. Does that answer everything?
Yeah. Yes. Okay, so I think this other question has already been answered by your presentation. You said if STI affect fertility in any way, and
yes,
you
it does
captured.
affect infertility. Yes, it is not just that it affects, it's a causative, is one of the causes of infertility in both male and female. So it has a very high risk of infertility. So it doesn't mean that every infertility is caused by sexually transmitted diseases. It just gives you a high percentage. So if you've had it in the past, or you've suffered from sexually transmitted diseases before in the past, or you've been treated for it before, there's a likelihood that you might have complications such as infertility, especially when it's not treated. So especially when not treated. So it is mostly the clause there is when not treated.
Okay, so I want to also ask, so how does my immunity play a role in all of this? Because it seems like there are some people who have had sexual contact with somebody who may have been already maybe immunocompromised, or I mean, already has one of the STIs, but this other person, assumably free, has sexual contact with this person and seems not to have been infected. So it seems like, is it a case of immunity or just a case of chance? What do you have to say to that, please?
Let me paraphrase this so that I'm sure that I got your question.
Okay, or more, in a more specific sense. So you hear of a spouse, you hear of a couple, and maybe because one of the partners had, external sexual partners, all right, and took ill, and upon his death, his or her death, is found to be, or during the management before he died, they found out that, okay, he was positive to one of these STIs. All right. And then on testing the surviving partner, the person is negative. So what would you say to that? Is that a case of chance, or is it a case of maybe immunity, or how do you medically explain this?
Well, medically, I think these cases normally present themselves with most times HIV infections.
Mhm.
So where you see one partner, we have one partner being positive and the other not positive. So have serodiscordant. So yes, sometimes in some cases, we may have the other partner not knowing the partner had the illness, and maybe the other partner is not receiving treatment. That's what I want to believe. And so as a result of that, the other partner is negative. So some people actually have I won't put it as resistance, but let's use the word resistance to getting the virus. So it's said that in the population there are some people that won't get this virus. You understand? So as a result, maybe that partner, it's not luck. I won't use the word luck because I'm sure if the partner has had multiple other partners, it's also possible that they have infected other people, but their partner just happens to be um not having this, maybe as a result of the fact that either they are not sexually active with each other at the time, or the partner in itself has a gene in them that doesn't allow them to get this disease. So yes, there are people who do not get the HIV virus disease itself. I think
Hmm.
this is where it comes into.
So this makes it more interesting. So can I go and do a test to know if I have that gene that makes me immune to these infections? And I know I'm free for life, perhaps.
Yes, it's possible. It's possible to get tested for that, but I really haven't been able to say okay, I haven't seen where people get those testings done yet.
Okay.
I've not had the opportunity to see anyone have the testing done, but it would be nice to. But I do not. It will not give you the opportunity because you are possibly okay. Let's for example, one does the testing and finds out they have this gene to prevent them from getting HIV. Does it mean now it doesn't stop you from getting other sexually
Mm,
transmitted diseases?
mm,
And earlier on in the slide, I explained that what is commonly spread are normally the bacterial sexually transmitted diseases. So imagine if you prevent yourself from getting one and then you get all the other ones,
mhm,
what then
mhm.
happens? So at the end of the day, is still practicing safe sex, irrespective of whatever the case might be.
Okay. I'm just trying to see. Okay, so okay, you said that it's best to test in facilities that you think are accredited. I don't know how one can ascertain that because
Yes.
someone may want to know, STI tests always correct? Are they reliable, or what would you advise? Do I have to try in maybe two or three facilities to be sure that the result I'm getting, either positive or negative, is reliable? Could you shed more light on that?
Okay. Like I said, is going to accredited labs per se. So yes, it's not possible for an individual or for everyone to know which is accredited or not. But there is a storage system. So you see, all these tests are done with certain reagents, and I know that they have certain half life or storage life that they have to be kept in for you to get appropriate results. So if, for example, maybe for example, you go to do a hepatitis B testing, and for example, it is in one facility saying positive, and you go to another facility, it is negative. Most times when we have such a result, we need a deal breaker. So we send you to a third facility to go do another testing to see which one is going to tell us if it's positive or negative before we could go ahead with management. It's either because as a result of either the storage of the reagents or the strip used for testing. This can be some of the things that can cause us to have some negative or positive results, as the case might be. So yes, it's not that you need to go to so many facilities. I don't know about every facility, but I know about our facility, and I know that we give out one of the best quality results currently in Nigeria. So if for anything, I know that yes, if you come to any of the EHA facilities, you're most likely going to get a very good result. That won't be most likely that if you take to anywhere, it's going to be the same thing.
Okay. Thank you, Dr. Peve. A few more to go. So we have this. It said, is there any relationship between alcohol intake and hepatitis B? Did you get that?
Okay. Yes. If there's a relationship between alcohol intake and hepatitis B.
Yeah.
Okay. What we say is, if you are taking alcohol, if you drink alcohol in excess, or if you practice alcoholism, let's use the word alcoholism in the sense that you get drunk and all of that, you are most likely prone to yourself into practicing unsafe sex, and as a result of that, you could get infected with sexually transmitted infections. But hepatitis B and alcohol are two different things. So having alcoholic illnesses are different from having hepatitis B infection. Now, they both affect one organ in the body, which is the liver. And so most times when people who have drank a lot of alcohol, they will develop what we call alcoholic liver disease. And as a result of that, they think when they tell them, they'll tell them, oh, you have a liver disease. So maybe it might not be very well specified to them. So it will cause you a hepatitis. Hepatitis generally is enlargement of your liver. So it will be that, oh, you're having a hepatitis. And so when you have that, they automatically feel that, oh, I'm having hepatitis B. But no, it is not. Hepatitis B infection is very different from alcohol drinking or diseases caused by alcohol itself. So you can have hepatitis B infection that would affect the liver. One of the complications of hepatitis B, or the complications from both of them, is they can both lead to a liver disease and cause and further go into causing liver cancer. So that's the very extreme cases of having both of them affected. But alcohol in itself and hepatitis B are two illnesses separate from each other. But taking alcohol in excess amounts could push you to getting yourself into unsafe sexual practices, maybe as a result of intoxication. And this would affect yourself. You could get hepatitis B from drinking alcohol in large amounts. Not that alcohol causes hepatitis B or something. Does this clarify it for the person? Please,
Yes.
whoever asked, you can signify by raising your hand if it has if it clarify the question.
Okay. As we try to wrap up, Dr. Peve, maybe you take this last two together. So you mentioned cancers in the last question,
Okay.
so I wanted to know, with this rise in case of maybe breast cancer and cervical cancer, do you think this is in any way linked to, our sexual behaviors? And then finally, would you give us a brief, assuming as a result of this webinar, I have not really done STI testing in a while, and I feel I should do some, or it's been, or I've never even done it. What are some of the recommended STIs that I can do to really know my status? So those are two questions.
Okay. So the first one says, um,
Is
please
there a
could you paraphrase
relationship
it for me
between
again?
is there a relationship between the breast cancer, cervical cancer with the sexual
And sex.
behaviors? Yes, and
Okay. So for breast cancer, most times it is genetically inherited. So there are specific genes for breast cancers. So breast cancers, I haven't had any, or I haven't seen a study that is related to sexually transmitted disease as the cause of the breast cancer. But for cervical cancer, in most cases, it's caused as a result of human papilloma virus. So if you're going to put it hand in hand, for the human papilloma virus is a major cause for the cervical cancer. So it's the reason why we are advocating. I'm sure all over the country currently, even the Nigerian government has just added the HPV vaccine into the vaccination plan for the country. So it is one of the major causes of cervical cancers, and cervical cancers are beginning to come on the rise. And that's because HPV can be in your system for the next 10. You could get infected with HPV and it could be in your system for the next 10, 15 years, depending on your immune system. If you're lucky, maybe 20 years. So it doesn't come very early, it comes in the old age. And so most times people begin to experience it in old age and say, I've not done anything bad, because probably you've been married and you've been practicing safe sex throughout that period. And so your mindset doesn't date back to how long ago. And as I said earlier, most sexually transmitted diseases are asymptomatic. They are highly unsymptomatic. So because of that, you most likely might not have the symptoms of it, or might experience some little abdominal crampings here and there. And like we said, HPV is a virus. So you might go in, and some people will go, just like I said, they will take antibiotics. They feel they've treated whatever it is that is wrong with them. And so it has gone, not knowing that it is causing whatever dangers that are there. As for the testing for the sexually transmitted infections, it is advised to, whether you actually have one partner or not. I always tell patients that you know yourself, you do not know the other person.
Mm-hmm.
Yes. So you can only vouch for yourself. You can only say I did or I didn't. And the other person, you can't say what he or she does. So it is always good to come in for the testing. We have like it is always termed an STI PCR. It contains tests for gonorrhea, chlamydia, trichomoniasis, and syphilis. We have venereal disease testing for syphilis. So we have a syphilis testing on its own. Most times they either take your blood sample or your urine sample for this testing. For the viral testing, we do a pap smear for the women to check for the human papillomavirus, blood testing for HIV, blood testing for hepatitis B, and blood testing for um, herpes simplex virus. Those are what you're most likely going to see. Those are the testings that you can do. And if, for example, one is a sex worker, it is advisable that they come in for testing every 3 months to make sure that they are regularly being tested regularly. But for people who have their one partners, it's something you can do either yearly or every 6 months, as the case might be, depending on your level of exposure to multiple partners or on safe sex practices.
Okay. Thank you, Dr. Peve, for this very enlightening session. You've really given us a very comprehensive overlook on this. And our guests on the show today, I believe you have been enlightened. If you didn't join in as at the time we began, you can still receive this recording in your emails. If you will just send a mail to us at academy@eha.ng, academy@eha.ng. I've just typed that in the chat section now. Sorry, let me do that again. Academy, ACADEMY at eha.ng to request for this this recording. All right, and you would have the privilege to hear it again and again, and also you could also receive the slide presentation from which Dr. Peve have just presented. Although the slide presentation would have to go hand in hand with the recording so that you'll be able to make a lot of sense out of it. So thank you very much, and then thank you, Dr. Peve. I don't know if you have any final words as we wrap up this session. Any last thoughts, Dr. Peve?
Finally, just to encourage every one of us, yes. Can you hear me?
Yes, please.
So, finally, just to encourage every one of us to please practice safe sex as much as possible. Also, please try to get vaccinated. Here at AHA, we offer vaccination for hepatitis B and human papillomavirus. We also offer testing for these sexually transmitted diseases. So if you're at any of our facilities, be it in Kano, Lagos, or Abuja, please try to visit any of our facilities and benefit from these services that we have. We look forward to seeing you, and we also look forward to you spreading the gospel to help reduce the spread of sexually transmitted infection in the country and in the world. Thank you.
Thank you, Dr. Peve. Lest I forget, I want to acknowledge the presence of the U-Lesson group who attended this webinar. Thank you for your engagement. We're grateful, everyone, for your participation. And don't forget, your sexual health matters, and keep seeking help and guidance as a sign of strength. Take care and stay safe, everyone. Bye, everyone. Do have a productive day ahead. Thank you, Dr. Peve, once again. Bye.
Thank you. Bye bye.